I think that right after the swearing in of President Obama, there was a climate for transformational change. I think it's still there, and I think the president could really be instrumental in bringing about just about any kind of change that he wants. For whatever reason, he decided to carefully construct a plan that would admit no chance for any real challenge to the market structure of private for-profit insurance companies. And you know, and he's worked very tightly within that system. That's a choice that he made. And during the campaign, you know, he made it very clear that he wasn't for single payer. He made it very clear that he was looking at reforms within the context of the for-profit system. I mean, that's a choice that he made. And, you know, it's not the choice that I would have made, but he's the president. And if his presidency's on the line, he made the choice for that. But at the same time, we have to look at the consequences of what happens if it fails. And you know, one of the things that Ralph Nader said, you know, you have to keep in mind, Ralph, that the House did pass 3 weeks ago a bill that, for the first time, took away the antitrust exemptions that insurance companies had. You know, we'll have to see what happens with it in the Senate. It's interesting that it passed without virtually any recognition in the larger media. It's as though that was chopped liver. That was a big deal. The insurance companies, you know, as someone who's going to vote for this bill, I've taken on additional responsibility to monitor an industry that's proven itself to be predatory. But at the same time, I just want to go back to what Ralph Nader said about the need to keep and hold fast to a single-payer movement. That has to happen. You know, I am not about to abandon that. I made that clear yesterday. I'll make it clear again now. Single payer is the only real solution. This is really a debate within the context of a for-profit system, something that I did not relish, and something that I'm looking forward to continuing to try to change. I've worked on this my whole life. I'm not about to stop now, but I looked at the moment and thought that it would be a mistake to be the one who sends this thing down to defeat and hope that then I can play a role to try to build some fragments from the ruins to try to create some kind of healthcare system and have credibility to do it.
Congressman Kucinich, Ralph Nader, I'd like to ask Congressman Kucinich one other question in terms of the role of the labor unions in all of this effort. Obviously, the Obama administration has gotten quite a bit of cover in its efforts to reform health insurance from organizations like SEIU that basically agreed early on to try to cut a deal with the insurance industry on what kind of health reform would occur, and then recently threatened to seek to unseat those who wouldn't vote for this plan. Your sense of how the role of the labor unions, especially SEIU, in the bill that is now before the House?
Well, labor is not a monolith. The SEIU has been strongly supportive of this, but there are also trade unions that have been leery of the ERISA preemption waiver, and because they have their own plans. I think that you have to keep in mind that labor's larger perspective here is they don't want the Obama presidency to go down because they're concerned if that happens, forces of reaction would set in that would make it impossible to pass employer free choice and some other things that labor really wants. So I think that, you know, you have to keep in mind, number one, labor's not a monolith. Number two, there were some divisions in labor on this bill that have been kind of muted. But for myself, I'm in Congress to represent the interests of working people, and I have felt from the beginning that single payer is the only real solution. This bill, as Amy mentioned, does does cover 30 million. As Ralph said, it's not going to kick in for 4 years. Look, I'm not going to be here to argue the merits of this bill, but to say that there is a chance now to leap over this process and go for more comprehensive reform without carrying the burden on our backs of saying that we've wrecked any chance for reform within the context of the present system. We have to change the system.
We're going to ask you both to stay with us. We're going to go to a break. We're going to come back because we're talking about health care, but we're also talking about this anniversary of the war, and they are related when it comes to what is paid for and what isn't. Congressmember Dennis Kucinich of Ohio, Ralph Nader, longtime consumer advocate, both have run for President of the United States. This is Democracy Now! We'll be back in a minute.